briefing. I hope everyone had a nice weekend. Obviously, it was beautiful weather, and we're dealing with some constraints, obviously, but I know everybody is eager to get an update from us today. We're going to have Supervisor Fletcher provide an update on our graphs and charts. Dr. Wooten's going to give us a medical update, and then we'll get right into the questions and answers. This is the final week of April, and it's a time for many of us that we've been preparing for. As we have said, we're trying to walk a fine balance right now, a balance between preparing for the gradual reopening of San Diego while maintaining and enhancing new measures to fight this virus. I know that some of you were out this morning eagerly awaiting the sunrise as we lifted the restrictions on individual water activities in our oceans and bays. I hope the surf was good, but please remember to check with your local jurisdictions to see which beaches may be open and what regulations are posted in regards to the use of those beaches. As we look to loosen some rules, we also have to tighten some. That's why on Friday our new order will take effect requiring the use of facial coverings when you go outside. We're going to go over that again today so as to eliminate any confusion. In short, we'll ask that you have one of these on at all times, a facial covering, it can be a scarf, doesn't have to be an N95 mask, and that you wear it when you come within 6 feet of another individual. In other words, it's probably going to be good to have something like this that you can pull up when you need to, when you come in close contact, 6 feet of someone, and you can take it down when you're driving in the car or you're riding your bicycle or out just getting some fresh air. As we look to reopen, we will be following the lead of federal and state authorities. Earlier today, Governor Newsom indicated that he will present a roadmap on how California will reopen, and he's going to present that tomorrow at his press conference. The governor mentioned 6 indicators the state will be tracking to inform its decision on reopening, so we'll all be following those indicators too and following the state's roadmap to reopening. I also want to make note that today the county opened 2 new testing sites in the region, one in Escondido and one in Chula Vista. These drive-by locations are being opened as a part of our effort to make testing as widely available as possible as supplies and capacity will allow. Now I want to specify that these sites are by appointment only. You can't just go up and get tested. People with symptoms who have a health care provider should contact their doctor to get tested. People with symptoms without a provider or health care coverage can call 211 and ask to speak to the nurse triage line to request a referral. The nurses can give a referral and make an appointment to get tested. Mobile testing sites will soon be deployed in other parts of the region to accommodate the growing demand for testing. The nasal swab tests at all 3 sites are conducted by county public health nurses and using the county public health lab. Results typically take 24 to 48 hours. We do sincerely appreciate your cooperation with all of these new testing sites. I know everyone is frustrated and wants to get back to some semblance of normalcy. We are slowly getting back to that, but the road there is long and there may be a few unexpected obstacles in our path. We will get there, but we need your continued cooperation, patience, and understanding. So let's move forward, San Diego, one step at a time. Thank you, and now if you'd please welcome Supervisor Fletcher.
Thank you, and good afternoon. As we come towards the end of April, we do not shift our actions. Our actions remain constant. Our commitment remains the same, but we do begin to shift our mindset into one of preparedness, preparing for the future, preparing for changes in our way of life, preparing for an uneven recovery and rebuild, and preparing to continue to be patient in a situation that is not only ever changing, but a situation that has multiple sources of information with cities involved, counties involved, states involved, federal governments involved, all of them trying to navigate through an unprecedented situation as best as possible. And I'd like to take a minute and just talk about the general approach and mindset and things and considerations that go into account for all of the various actions that are being taken and are likely to be taken in the coming weeks and months. The simple fact is there is no perfect way to address an unprecedented global pandemic. We are trying as a county as best we can to navigate through a difficult and ever-changing situation, mindful of the dangers of COVID-19, mindful of the total impacts on public health, and mindful of the needs of our community. While we have been generally successful in flattening the curve in San Diego, in particular in April, we must continue to show meaningful progress. The governor stated today in his address that he believes the state of California is weeks, not months away from seeing easings of statewide protections, particularly those around businesses being open. But he also pointed out that we can't lose our focus now, that losing our focus now and losing the progress we've made now would imperil our ability to move forward. And so we are hopeful that the numbers continue to trend in the right direction and that we can take additional steps to ease some of the restrictions. But it's important that we all understand and keep in mind that none of this will happen all at once. It will be like a dial that turns slowly and in small steps. We take a small step, we pause to monitor the impact. If conditions warrant, then we're in a position to take another step. Our cases in San Diego County have been low compared to other areas of America and the world, and the impact on our healthcare system has been manageable. Again, a marked and stark difference between other areas in America and throughout the world. But we have to continually ask ourselves, why is it that our cases have been low compared to other areas and our health system has been able to maintain its integrity compared to other systems? It is because of the actions that we have taken. And so as we come out of this into a posture of potentially changing some of those actions, we have to be very intentional, we have to be very thorough, and we have to be very thoughtful in how, as we ease out of some of these, even with small steps, that it does not trigger a situation like we saw in other parts of the world. We have to continue to be very patient, and we are not by nature a very patient people. Both patient with the changing nature of the situation, patient with the changing sources of information, patient with the more accurate way of measuring what we are facing, along with patient in realizing that there are a lot of entities from your city to your county to your state to your federal government to your hospital system that are all involved in managing through this together. And we have to do that in a time when we're not a historically very patient people. It really is resilience that we're looking for as we work our way through these, through the challenges, through the opportunities, through each and every one of these steps, knowing that as a community we are all in this together and we are all doing the very best we can in a very difficult situation. I've been asked the question about, given coronavirus is just as contagious as it was at the beginning, how is it we could contemplate easing without expecting a significant and massive spike? And the answer is that it depends on how we do it. It depends on doing it in a way that where we change our behavior, we change our posture, we change the way that we go about life. The hope is that by greater awareness and commitment of the need to physically distance, by greater awareness and commitment of the need to wear a face covering, by greater awareness and commitment of the need for hand washing, greater awareness and commitment of what to do if you have symptoms. The hope is that by all of these things combined, the greater awareness and commitment, that as we start loosening things in the coming weeks and months, that it won't have a significant impact on our public health posture because we will be living our lives in a way different than we were in January and February. But we're not going to be able to immediately go back to everything all at once. And there is no way we can design a phasing system that addresses every concern or every question. As we take steps, they will not always be perfect. You can't take small steps, even as intentional and well thought out and meaningful as they are, and have them address every concern or every interest. But the goal is to take action. The goal is to create forward progress, but create forward progress in a way that ensures we're not compromising the integrity of our healthcare system, to create forward progress in a way that ensures it is manageable, that is achievable, that we can avoid large gatherings and we can avoid the rapid transmission and spread. And that is what we are striving to do, to take a small action, a small step, and begin forward progress. The beaches are a good example. We've said from day one that it is not only okay, but it is advisable to get outside and exercise. It's a vital part of life. You just have to do it responsibly. At the early stages of our coronavirus exposure, it was simply not possible due to the overcrowding that we saw at the beaches. And so we had to restrict and stop that. So now we're in a posture where we want to make it a little bit easier to get outdoors because we believe that the public can do it in a responsible way because of that greater awareness that I talked about earlier. Because as we begin to move into a new era, we all begin to operate in a little bit different way, in ways that prior to this we never imagined. We never imagined a world where we would purposefully physically distance from non-household members. We never imagined a world in which we would wear face coverings. But that is the world that we are in. And it is the world that we are going to be in until such time as we have a vaccine or a widely available therapeutic drug. And so based on our general flattening, based on the integrity of our healthcare system, combined with the reality that getting outside is essential, we allowed our coastal cities at their time and choosing when they are ready to provide the option to allow people to get back in the water. But we had to do it in a measured way. We had to leave parking lots closed from overcrowding. I don't like how that limits access to our beaches. But unfortunately, the first step and phases have to be done in more restrictive ways, or we would have no path to begin moving forward. We had to limit sitting down or laying on the beach or playing group activities. Because as we just saw this weekend in Orange County, that leads to not only more people at the beach, but it leads to people staying there longer, which leads to overcrowding situations. Overcrowding situations is what has the impact negatively on our public health system. We had to not include boating because you can't reasonably physically distance on a boat. It isn't that our public health folks don't like boaters, they do. It's just that it wasn't the most appropriate first step. And this is an example that you are likely to see replicated in multiple phases as we begin the process of moving forward. Small steps, monitor the impact. If the impact is positive, then we can begin to take additional steps. If not, then we may have to pause where we are. If the impact is negative, we might have to turn the dial back. And so we ask for your continued patience and your continued understanding that as we go through this in a complex society, with a complex economy, with complex recreational opportunities, it will be difficult to navigate through, and we ask for your patience. We ask for your continued commitment and your continued understanding that the aim and desire is to see our county rebuild and recover on a slow, steady, appropriate pace that ensures the adherence to public health. The simple reality is you are not going to be in a position to rebuild an economy until you have customers that are comfortable going out. And that is not going to happen until we have fully developed all of the measures that we need to be able to truly tackle this in an ongoing way and in a method that is going to see us through until such time as we have a vaccine. I want to talk for just a minute about a couple of the things that are guiding a lot of our actions here at the county as we go into this mindset of preparedness. The first relates to general metrics related to opening and closing. We've seen guidance from the federal government around the ability to move into what they deem as phase one. We know that we're likely to get additional guidance from the state of California, perhaps as early as tomorrow, about what they see as those key measurements. We will take those, the federal ones and the state ones. We will assess our situation locally, and then we'll be able to begin to convey to you exactly what it is we need to see that triggers the ability to do easing, what it is that triggers the requirement to stop or pause where we are, and what it is that would trigger the requirement for us to turn the dial back. These metrics are likely to be continually refined, continually enhanced, perhaps continually changed, but we will always tell you what we are measuring, what it tells us, and why, and then if it changes, we will explain that. Right now, we are presently spending a lot of energy and effort talking about the percentage of testing that is positive, because that is not only a federal indicator, we think that that is a more appropriate reflection of where we are as a community than just the raw number of positive tests. Right now, we are also spending a lot of time focusing on the impact on our healthcare system, both from COVID, but from everything else, because that tells us a lot about where we are in relation to critical capacity or critical point at which our healthcare system becomes overly taxed and overly strained, because we think that is an important indicator. And so we're going to continue to refine those to identify, again, what is that green light that may say go, what is the yellow that may say pause, what is the red that says stop and go back, and we will continue to work through that both with the state and federal government. The second area is around testing, tracing, and treatment. We know there's been a lot of discussion around testing, and we know that that will continue. But it is really important to recognize that it is not just the testing that is an indicator of our ability to begin to move forward. It is all three of them together. There has to be a robust system in place of daily testing capacity. If we can rapidly identify every positive case through robust, available, accessible testing, we can ensure that that person gets the results, that they isolate, and it does not spread. Then very rapidly, we have to track down every person that person has been in contact with, talk to them, offer them testing, assess them for symptoms. That is the tracing. And we'll have to contact these folks multiple times over periods of time. This is something that is a cornerstone. It is a hallmark of public health and infectious disease. It is something that we do very well, but we have to do on a scope and scale the likes of which we have never imagined. And we will meet this challenge, and we will do this. And then the third piece of that is the appropriate treatment and isolation for those individuals who test positive. If they don't have the ability to isolate at home, they don't have a home environment that allows it, then we have to make sure that we have the capacity to meet those needs. Again, this is a system that is not just going to be in place for the next month. This is a system that will be in place for the duration of our coronavirus exposure until such time as we have a vaccine or wide-scale therapeutic treatment. It is what we have to do on a daily basis and what we need in order to be able to mitigate and move forward. We've talked about beaches. I want to reiterate about parks for a second. Each individual city and jurisdiction has the ability to have their parks open if they choose. Some have chosen to have them open, some have chosen not to. But there are countywide restrictions around parks that are in place to this day. Those countywide restrictions relate to parking lots being closed, parks only available for passive activities. You can walk, run, or bike, but you can't sit and stop. You can't play sports. You can't do things like that. And cities have to be able to physically distance. As we consider lifting some of those countywide restrictions, we are working with local jurisdictions. We are asking them to come up with their plans and their protocols for how they will do mandatory signs, for how they will protect the health of those who are there, how they will enforce it, how they will have proper staffing, all of those types of things. Again, we've outlined we would like to lift the countywide restrictions on parks in part, perhaps as early as May 1st, but we are working with local jurisdictions, encouraging them to develop their plans and design their plans around that. And then as Supervisor Cox mentioned on Friday, we announced mandatory face coverings, and this is another part of us as a region adapting to the new normal. We believe face coverings are going to be a part of our way of life moving forward for the foreseeable future. We'd had a strong recommendation that individuals utilize a face covering when you leave your home, and it's become clear that it's time for this to move beyond just a strong recommendation into something that each and every one of us do. We've seen some cities move forward with this being a requirement, and we think that that action made sense, and it made enough sense that we should expand it countywide. We are putting May 1st as an implementation date just to give folks a little bit of time to track down a mask or a face covering, but that is only 4 days away, and I think that most San Diegans are complying with this already, and to those San Diegans, we say thank you. Your actions are not only protecting yourself and others, but as we move forward to the Friday deadline, we want to encourage all San Diegans to ensure that when you leave your house, you have a face covering. The order says when you come in within 6 feet of someone who's not a household member, you should have your face covered. The easiest way to do that is when you leave your house, have it with you and cover your face. If you find yourself all isolated, alone, not anywhere near anyone else, then common sense would apply. But the aim is to prevent the spread and transmission of coronavirus, and the aim is for us as a region, again, to continue to prepare both mentally and as a way of practice of the types of things that we're likely to see for the foreseeable future. With that, I want to give a quick update on the homeless shelter testing. The number of tests administered is 663. That is 458 residents and 205 staff. Out of those, as we announced this weekend, 2 have tested positive. Both of those individuals are moving into county public health rooms. 644 have tested negative. 17 test results are pending. The testing is resuming this week, and we will get to universal testing where every resident of the convention center will receive a test and will take a test moving forward. With that, I'm going to jump into our charts for today. The first one shows 98 new positive cases out of 823 positive. This is a 12% positive rate. 12% is higher than what we've been trending on average. This is obviously as we look at these percentages, we are going to see day-to-day fluctuations in the percentages. And what you see in the purple line there is the rolling percentage positive on a 14-day time period. This rolling average is more important to us than the day-to-day totals, but we would like to see these percentages continue to trend in a negative or at least flat direction. And so we will continue to monitor and watch with great interest the day-to-day percentages. You also will note the day-to-day variations in testing. That has been true since the beginning of this. We would like to see that begin to increase in a steady way as we increase the number of actual tests being conducted, but we will continue to monitor that. The second chart here, I want to point out a slight change. The total bed capacity on the top is the licensed bed capacity. This is the licensed bed capacity for our healthcare system, but not every licensed bed is an equipped and staffed bed in San Diego County. And so the more accurate reflection is the purple line you see there, which is current bed capacity. Those are beds that are available, that are staffed, that are equipped, that are ready for patients. And there you can see that today we are reporting 363 COVID-related patients in our area's hospital systems. Brings us to a total of 3,295 beds, the blue being non-COVID patients who are utilizing a bed, and the orange being COVID patients. And again, you can see a relatively flat line across this chart going all the way back to the beginning of April, and that is an encouraging trend, an encouraging sign. The last chart has the cumulative totals, which again are less, tell us less than the percentage of positives, but you do see the doubling rate of positives there every 17 days. The estimated number of recoveries. The hospitalizations is cumulative. On the previous chart, you can see the current hospitalizations, but there you see the doubling rate of hospitalizations at every 26 days. That is an encouraging number. ICUs at 36, and the unfortunate loss of life at 113, which is a doubling rate of every 21 days. With that, I would like to turn it over to Dr. Wilma Wooten for her Public Health Officer's report.
Thank you, Supervisor Fletcher, and welcome and good afternoon, everyone. We are continuing to plan for reopening of our county, but we are doing this and must do this in alignment with the state guidelines. The county is utilizing federal guidelines, opening up America again, and the governor's roadmap to modify the stay-at-home order. In the president's guidelines, as you will see on the slide now, I just really want to continue to emphasize the 5 metrics that comprise the gating criteria that must be met before states and regions will consider proceeding with a phased approach to opening. Next slide shows the metrics that are related to symptoms, and there are 2 metrics here that we are focusing on. A downward trajectory of influenza-like illnesses or ILIs that are reported within the past 14 days in our emergency departments, and we are doing well with this particular metric. The second is a downward trajectory of COVID-like syndromic cases reported within a 14-day period of time. And this is an area where there is more work to do, and it's contingent on the assistance from the general public with staying at home, maintaining the physical distancing so that we can see a decline in the spread of this infection. In the next slide, as it relates to hospitals, the goal is to treat all individuals without crisis care, a crisis care model. And this really is also related to hospitalizations, and Supervisor Fletcher has talked about this as well, and we seem to be moving or trending in the right direction here. The last, or the next rather, under hospitalization is testing. But I want to go to the next slide, if you will. And actually, if you can go back one, I think we skipped one. There was one metric related to testing, and that is the positive tests as compared to all tests performed, and Supervisor Fletcher also talked about that one. Now, if we talk about testing, and you can stay on this slide, number one, that is the fifth metric, which is developing a robust testing system. And under the California's roadmap, the first indicator is the ability to monitor and protect our community through testing, contact tracing, and isolation, and supporting those individuals who are positive for COVID-19 or have been exposed. And the county appears, when we talk about those 5 metrics, the county appears to be meeting 3 of them, and we feel that we will rise to the occasion for testing. So the metric related to symptoms for COVID-19 syndromic cases, that is the one that we have to do more work on. When it comes now to testing, the county's laboratory testing task force will be meeting this afternoon at 4 o'clock. And so far, in preparation for that task force, a survey was conducted to identify barriers to testing, as well as to identify the full capacity of testing through our county public health laboratory, our hospitals, and our community clinics and commercial laboratories. And this indicator is, from the governor's roadmap, is one that we are spending a lot of time on. Again, the task force for laboratory testing, our contact tracing, and isolation. So we have work groups for testing. We have a work group and an action plan also for contact tracing. And we have been conducting isolation of individuals, and we will continue those efforts and expand as we increase our testing capabilities. These elements are all related. Getting back to normal will involve a phased-in approach using the federal guidelines, as I've reviewed. And if we meet these 5 metrics, as I've described, phase 1 will involve specific guidance for individuals, for employers, and specific types of employers. For individuals, we will continue to require social distancing and, has already been stated, covering your face. We will also require vulnerable groups and older adults to stay at home. And for employers, we will recommend teleworking. That will still be encouraged. And we're asking work sites to return to work in phases. And when at work, we also will continue to request social distancing be enforced. And if there are special populations at work sites, we are encouraging personnel who are members of a vulnerable population to take special care and avoid exposure. Lastly, for specific types of employers, schools and organized group or youth activities such as day camps will continue to be closed. Visits to long-term care facilities will continue to be prohibited, and necessary surgeries have been allowed, as you are aware last week, as necessary and determined by the hospital system. Recommendations to cover your face in public will still be in effect and will become mandatory at the beginning of May. We will continue to promote practicing social distancing of 6 feet between individuals, continue hand washing practices, and if individuals are sick, to stay at home and self-isolate. So now I'm going to provide just an overview of our statistics. Regarding global, national, and state statistics based on data from Johns Hopkins at about 12 noon today, globally we are now at over 3 million positive cases, including 208,000 deaths. Nationwide, over 978 positive cases have been reported, including 55,000 deaths. Statewide, California is now reporting 43,000 positive cases, which includes 1,700 deaths. And today, the County of San Diego is reporting 3,141 cases, which is 98 more cases than yesterday, as well as 113 deaths, which is 2 more than reported yesterday. Of the 2 additional deaths, these include 1 female in her early 60s and 1 male in his mid-50s. These 2 additional deaths, these individuals did have underlying medical conditions. And of the 3,141 cases, the age range is the same, from 3 months of age to 100 years of age. The percentage for individuals 20 to 49 remains at about 51%, and there are 49% female and 51% male, and now only 3 individuals have no gender identified. 706, or 23% of our total number of cases, have been hospitalized, and this includes 230, or 7% of the total, but is 33% of those hospitalized. Lastly, the 113 deaths represent approximately 4% of the total number of cases. Also, of the 113 deaths, 45% are female, 55% are male, and regarding race and ethnicity, we have data for 96% of the 113 deaths. This includes 57 or 53% being white, 37 or 34% Hispanic or Latino, 9 or 8% Asian, 2 or 2% Black or African American, and 1 each for American Indians, Pacific Islanders, and individuals of multiple races. 5 of the 113 deaths had, to date, unknown race and ethnicity. Once again, our sincerest sympathies as well as condolences do go out to the families of the individuals that we announced today as having succumbed to COVID-19. As a reminder, all of our demographic information is provided on our county website at www.coronavirus-sd.com. Regarding outbreaks in our congregate and community settings, today we are reporting a cumulative total of 41 confirmed active outbreaks. This includes 27 outbreaks in congregate facilities. We have 1 new outbreak since yesterday. This represents 620 cases and 55 deaths. And we have 14 active outbreaks in community setting locations, which includes 1 new outbreak since yesterday and representing 108 cases and 4 deaths. Again, I would like to commend the public for really staying the course to stay at home and helping us drive down the numbers for COVID-19. We are indeed truly sensitive to the fact that everyone is making a tremendous sacrifice. And as you have heard today, we will explore the metrics and where we are to start to try to dial down and try to get businesses to start working again, but at a very metered and dialed down approach. As a reminder, May 1st, we will require everyone to wear a face covering when in public, and we continue to be optimistic that the metrics I've shared with you today will continue to trend downward. Now, please welcome Supervisor Cox back to the podium.
Okay, we'll go directly to the questions. Again, if your outlet and your name is not identified in the introductions, please make sure you do so before you ask your question.
Lisa Halverstad with Voice of San Diego. Please state your question.
Hello, thank you. I am calling because I'm wondering, over the weekend there were 2 individuals at the convention center that tested positive for COVID-19. And I'm wondering if the county has directed any new protocols or steps to be taken at the shelter in response to those positives. And obviously there are lots of people staying at the shelter, so I'm also curious, obviously the individuals would have had probably a lot of contact with other shelter residents. So I wanted to learn what's being done potentially to contact trace and monitor the health of individuals who may have had contact with them. Could there be retesting, close monitoring, maybe even isolation of some of the individuals that are still at the shelter?
Okay, I think Supervisor Fletcher is going to respond.
Thank you. I'll take the first part of that, and then I'll let Dr. McDonald talk about the contact tracing part of it. As it relates to the convention center, we know that this is a vulnerable population. We know that this is a high-risk population. We also know that any congregate care setting is one in which you have to take great precautions. I think that there was tremendous concern when you saw the stories out of San Francisco, Boston, and other places where they had significant percentages of individuals in homeless shelters test positive, significant percentages. But I think in large part, our numbers are likely to be lower than those other jurisdictions for a couple reasons. The first is we started earlier with screenings for the overwhelming majority of these individuals who were in individual shelters. They weren't physically distanced, but we were able to get public health nurses in there to look for symptoms, to check for temperatures. We did remove folks from those when they had temperatures or symptoms. We got them into our public health motel rooms. We were able to get them evaluated and tested and screened. And so when those individuals were transferred into the convention center, again, the convention center had to be designed and laid out with a tremendous consideration of ensuring physical distancing. And I want to commend the staff that are down there because this is a very difficult task. And to put them in there in that environment where you are doing everything you can to ensure physical distancing, and you have them in an environment with additional daily wellness checks, with temperature checks, with the looking for symptoms, I think that that is probably the reason why only 2 out of more than 435 residents, 667 total tests, including the staff, why we've only had 2 positives. But it is a reason for us to redouble our efforts. It is a reason to know that 2 individuals who were there were positive, to reevaluate everything we're doing. And some of those, I believe one of those had come in from unsheltered directly into the convention center, had not come via another shelter. And so what I'll say is I know that the team that is down there, a joint effort of the Regional Task Force on Homeless, the City of San Diego, the County of San Diego, the Housing Commission, I know that they are working tirelessly to make that environment as safe as possible and to look for everything that they can possibly do that might be to increase the protections that are there. So in general, we always expected, I don't think you could pull 600 folks out of any neighborhood in San Diego and test them and not get a few positives. I don't think it's any different here, but I think our awareness, our intentionality, and our focus is much different here. And so we'll continue to look for better ways that we can do anything. Along with, it's vitally important we continue all of the testing all the way through. I know it's been important to the mayor, to myself and others that we get universal testing of everyone who is down there. And we get those results so we know what it is we're dealing with. I'll have Dr. McDonald address the issue of contact tracing for positives.
Sure. All patients who are notified or we're identified as having COVID actually are interviewed, and we do an evaluation for contact tracing. In this particular environment, because we have public health nurses there, because we're actually monitoring individuals in terms of their current health status and checking their temperatures, it's actually a little easier to do contact tracing in that environment than it might be, say, in another environment. We are working with the staff there to identify any individuals who may have had very close contact with this individual, and if we deem it necessary, we will actually quarantine those individuals also in one of our hotels. I do want to emphasize that both of the individuals who are identified are currently isolated and are being given the proper care.
Could there be any, Dr. McDonald, could there be any retesting that occurs as a result of these positives and just folks that are proximate to them at the shelter?
That's a good question. Certainly anybody who develops symptoms really anywhere in that shelter is going to be tested. That's one of the issues that we want to be very clear about. It's when you develop symptoms, you certainly should be tested, and we're doing that already. Those other individuals, it's unlikely we would need to test them if they were identified as a close contact unless they developed symptoms.
Thank you.
Okay, let's go to the next question.
Gabby Rodriguez with NBC7 and Telemundo, please state your question.
Hi, yes, I had 2 questions. I'm just going to follow up on something that was said regarding the 2 people who tested positive over at the convention center. So according to the press release from the mayor's office, one of the people, a female, after testing positive, left the convention center and was unaccounted for some time. A public health order was issued for her. And as of yesterday, I was told she was found and is now in isolation. But since she was out and about and we don't know where at this point, was the county able to do any form of contact tracing on this person after she tested positive and left the facility?
Okay, Dr. McDonald's going to respond.
The answer is yes. We were able to extensively interview the individual when we, in fact, got her by cell phone, was able to contact her and get her into isolation. She had actually really had no essential contact with any individuals in the community. She went for medical care, is what she ended up doing. So we were able to bring her back into isolation and absolutely identify anybody who was in contact with her while she was not in the facility.
Great, thank you. The second question is regarding the COVID clinic, the drive-through testing location in downtown. Do they need a CLIA certification if they're sending their testing samples off-site? And do you guys have any update as far as what the county's position is on this testing site since it was discussed on Friday?
Well, as I think I've answered before in several previous conferences, really the oversight of these particular facilities is with the laboratory field services of CDPH, and the proposal that the COVID clinic had to use an in-state laboratory to be able to gather specimens and send to that CLIA-certified laboratory met the regulatory requirements that the state had, and that is why they were allowed to continue to proceed with their current testing activities.
And sorry, one last question. Your guys' reaction to seeing what the beaches look like today as soon as they reopened, do you guys still feel that it was the right call to make to reopen, even if it's in a limited capacity?
Thank you for that question. The actions that we took were to allow individuals to go into the water to surf, and as long as they maintain while they were on land social distancing practices, we felt it was safe for them to go into the water. So that was the basis for our recommendation. Thank you.
Thank you.
Okay, let's go to the next question.
Paul Sisson with the Union Tribune, please state your question.
Hi. As it was explained last Monday, I think it was Supervisor Fletcher who said that the plan to reopen water access at the beaches was going to go forward as a coordinated effort among all the different coastal cities. That's certainly not what we've seen today. We've seen the city of San Diego open its beaches and Encinitas do so, and some South Bay cities as well, but not so much some North County cities. It's been kind of a hodgepodge opening, I think you could say. Why did the county decide to lift water restrictions before all of the coastal cities were ready to participate?
Supervisor Fletcher is going to respond.
Thank you, Paul. We asked the coastal mayors to meet, come up with, as best they could, a consensus on what they believed would be the ideal plan to do it, along with their assessment of could they viably do it. What was conveyed to us last week, both in a letter and I'm sure you saw in a press release, was there was a unanimous agreement amongst coastal mayors on the how they would do it. The when, as that was put in that same press release, would be up to the county and in particular up to our public health officers. So we took that plan that was sent to us on behalf of the coastal mayors. We made some modifications to it. There were some things like boating and some other things we didn't think were appropriate for phase one. And then we did a countywide, we made it accessible that individual cities could decide if they wanted to move forward, that we were giving the okay. But we said at the time that that was a decision that each city would make. If you go back to Friday, we said multiple times that each city could do it on their timeline. But we were presented a plan from the working group of coastal mayors. We were told there was a unanimous opinion of the coastal mayors and lifeguards that that was how they would like to do it. We evaluated the how. We made some changes based on input from our public health guidance, and then we moved forward with giving them the option to move forward. If some cities do it at a different pace, I don't think that that is a tremendously bad thing. Some cities were ready to go a little faster and a little swifter than others. I think most of them are moving towards the goal and the outcome And I think that it will work itself out okay. But again, every city has at their discretion the timeline for doing that if they choose to do so. I don't know that you would have ever gotten unanimous agreement from all of those individuals on exactly what date or exactly how, but we are doing the best we can to put out a countywide framework, at least, of if you do choose to open, these are the conditions under which you would do it.
A follow-up, why couldn't the county have just said, everybody needs to open on the same day, on this certain day? We are going to make the decision for you guys, so we have a uniform opening and we aren't funneling people into, say, Moonlight Beach, for example, and Encinitas.
Well, for example, the county doesn't have any authority to tell the state parks what to do. The state parks will determine for themselves what it is that they want to do. The other thing is, if you have significant cities that are ready to go on a timeline, then it would seem appropriate that they could do that, where you may have smaller jurisdictions that may take them a little bit longer until they're getting ready. And so if you were to wait for the date where you had absolute agreement by everyone on every time and place and thing, then you might never arrive at that date. We thought that what was most important, having been conveyed to us that there was unanimous agreement of the coastal mayors that this was the phasing that they would like, we took that recommendation and that unanimous agreement. We evaluated it through our public health department. We made some modifications to it, and then we said you can choose to move forward with this at your pleasure.
I wonder, though, as we go forward, is it a tenable position to have some beaches open and some not? Doesn't that just bring everybody from the county into a closer proximity than would otherwise be the case if all 70 miles were open at once, so that people go, to a place closest to where they live, but versus maybe driving or cramming into areas that are open?
Well, there's a lot of things that might be better that are not possible. So it is not possible for us to tell the state of California what to do. They will decide on their beaches what they want to do at the time of choosing. We didn't think that there was a public health danger from allowing cities, if they chose and if they believe that they can enforce physical distancing, to open. Now, if we see that those cities are unable to ensure physical distancing, if they are unable to ensure the plans that they've written, then they're going to have to make adjustments to what they do. But I think as we move forward, you have a situation with parks where every jurisdiction has the ability to decide for themselves should they have their parks open or closed, right? Some have them open, some have them closed, some have them modified. And the reality is you have jurisdictions that are very different, that have very different situations, and I think that we have to strike the appropriate balance behind providing a countywide framework along with allowing jurisdictions a little bit of flexibility to match the needs and conditions that they see in their community, and that is a balance that we try to strike. If you go back to parks, we have countywide restrictions that apply to all parks. But then there are some sections in some areas where locals have the ability to exercise their own discretion based on their staffing, on their community, on what they're comfortable with. And so we'll continue to try and strike that right balance between things that are broad across the entire county and things that individual jurisdictions have some flexibility in terms of doing. I think what you will see in the coming days is probably most local jurisdictions will come up with their plan to reopen. They will open and it will work out okay. But again, this alludes back to what I talked about in my earlier comments, that there is no perfect way to do a lot of these types of things that we're trying to do. There is intentional thought behind what we're doing, and I think that we are definitely doing the best that we can. But when you have so many jurisdictions and so many considerations and so many different individual leaders, I think what we have to strive for is finding the smoothest, best possible path available to us. And I think that we've done that with the beaches.
Thank you.
Okay, let's go to the next question.
Marilee Moore with Fox 5. Please state your question.
Hi, I have a question going back a bit to the mandatory facial coverings that begin on May 1st. Wondering how that's going to look for enforcement purposes. I know you said that people don't necessarily need to have them on if they're not within 6 feet of people who are not in their household. So just talk to me a little bit about how this is going to be enforced going forward beginning on May 1st.
Okay, Dr. Wooten's going to respond.
Thank you for that question. And we will use the same enforcement practices that we're using now for all of our health officers' orders. We hope that people will, on an honor system, adhere to the order that's issued. And if our police that are circulating in the community in the various jurisdictions. The various jurisdictions have the responsibility or the authority, the police in those jurisdictions, to enforce. And as you may or may not know, there have been many not permits, but there have been many issuances of fines for individuals that have not been adhering to our health officer's orders. So we hope and anticipate that that will continue.
Okay, let's go to the next question.
Will Huntsberry with Voice of San Diego, please state your question.
Hi there. So Dr. Wooten mentioned today the 5 criteria laid out by the federal government, and those are a downward trajectory in influenza, downward trajectory in COVID symptoms, people coming into the hospital, downward trajectory of % positive cases. Then the last 2 were to not be in a crisis care model and to have robust testing in place. So I was listening to your remarks and noticed, you said that we checked the box on 3 out of 5 right now, and that, you expect robust testing to come online soon. But I was unclear on what is the other check box we're missing there. So if we're missing testing of those 5 criteria, what's the other one?
Okay, Dr. Wooten.
Thank you, Will, for that question. The 2 that we still have work to do on, again, is the robust testing, and we are very confident that by the end of this week, we will fulfill our goals, strategies, and outcomes related to that one. The second one is related to the COVID-19 syndromic cases. So last week, I showed a specific graphic that compared influenza-like illnesses since March 14th. Our ILIs, or influenza-like illnesses, have gone from 10 down to 3%. For COVID-like cases, the syndrome associated with that, it's been variable, and at best, it's flatlined. So we are really looking at that through the rest of this week to show where that is. So the 3 that we are confident where we've met is the downward trend of influenza-like illnesses, the downward trend of positive tests, and then treat all patients without crisis care. So the 2 that, the robust testing on the right and on the left bottom, a downward trend of COVID-like cases. So those are the 2 that we are closely watching, particularly the one on the left, lower left, but we are confident that by the end of the week, we will achieve our robust testing program outcomes. Does that answer your question?
Yes, thank you for that clarification. My one follow-up, or 2 follow-ups, are could we look at hospitalizations instead of COVID symptomatic cases? Because they have been going down for 14 days or so now, I think, if I'm right. And then my second question is also, is the Panther testing system online yet? And is that capable of doing 1,000 tests a day?
So you are right on both of those. If the staff can go back to the metrics, hospitalization is the metric that we're using for the crisis care. So we are not in a crisis care situation. We have good capacity. And so hospitalizations, you're absolutely correct. Supervisor Fletcher talked about that. So that is the metric that we are using for that particular component. And then for robust testing, the county actually on Friday stood up actually, we set it up a little earlier, but we validated it, and we were ready to test utilizing that system on this past Friday. So we feel that with that platform being stood up, with the drive-through testings in North and South County, and with other mobile testing strategies coming on board, we are confident that we will achieve the goal that we want to achieve by the end of the week, or at least by early next week. So does that answer your question?
Yes, thank you, Dr.
All right, you're welcome.
Okay, Dr. Wooten, thank you so much. We have a question from Bridget Naso at NBC7. Given that we now know people who are asymptomatic can transmit COVID-19, when do you anticipate that healthcare providers and county testing sites will be able to expand testing beyond people who have obvious symptoms to people who have lesser symptoms and therefore can test more people?
So thank you for that great question. We've already done that. We issued our 14th KHAN last Thursday. That includes prioritizations from the state, or rather federal prioritization, 1, 2, and 3 from the state, 1, 2, 3, and 4, which does include asymptomatics, and the counties. And for the County of San Diego, one of the niche areas that we are focusing on is long-term care facilities, both individuals, staff, and residents that are symptomatic and asymptomatic, and included in that, I'd ask you to take a look at that. Included there is also healthcare workers and first responders, both symptomatic and asymptomatic.
And how much closer does the opening of these 2 new testing sites get the county to reaching its goal of having the ability to test 5,100 people a day in San Diego County, or the threshold you're looking for in order to get a better picture of what's happening here with COVID-19?
Well, every additional strategy that we onboard gets us closer to our goal. So it gets us closer. I don't have a percentage for you. We can go back and do the math on that, but having the drive-throughs in North and South counties helps to increase the county's component of the overall testing strategy.
I have a question from Sasha Fu with KUSI TV regarding the face coverings, the order that takes effect on Friday. Does this also apply to employees inside a workplace? Does the employer have discretion over whether face coverings should be required within that work environment?
We will be expanding. As you are aware, currently there are 7 categories for employees that are mandatory, and we will be expanding that to include worksite as well as general public. So the answer is yes.
Okay, and to follow up to her question, if an employee decides to self-quarantine for 14 days because of a doctor's order, is the employer obligated to tell the rest of the staff that the employee is in quarantine for possible infection? Is that a health privacy violation? And is there a health public obligation to tell the rest of the staff, particularly if they are in a high-risk group, like someone who has an autoimmune deficiency?
So if an individual is positive for COVID-19, the person that should be notified would be their supervisor or HR. It is not, no one has to notify the rest of the employees. When we have a work site that has a positive test, we provide them with information that lets them know that someone in their work site is positive, and they get information, to a letter or information that they can share with the rest of their employees, but never is a specific name identified.
So their direction should come from their doctor if they decide to self-quarantine.
So the self-quarantine part, yes, that's the decision between the individual and their doctor. If they need to do that based on recommendations from their providers, they should let someone at their job, particularly their supervisor and or HR, know.
Okay, this question is from Andrew at Fox.
And I can tell you, can I just ask?
Of course.
And I can tell you, because if it is at a work site, obviously our EPI program is notified. So again, communication to that business is conducted by our EPI program.
Okay, great. And this one is from Andrew from Fox 5 regarding the testing sites in Escondido and Chula Vista. How many tests does the county plan on doing at each site, and what other county testing locations are in the works? And I'll have a follow-up to that when you're done.
So currently at North and South County, they are open from 10 to 3 o'clock. We have one lane opened to date. As we get an idea for the demand, we will expand. So in a given day from 10 to 3 o'clock, we can test 30 individuals for one line. So we want to expand to multiple lines as we get more demand for testing.
And other locations?
We will make those announcements as other locations are identified.
And why are appointments necessary before arriving at the testing sites?
Well, someone has to manage the results, and that's not the county would not do that. So we want to conduct the testing in collaboration with a provider so that the provider can follow up on that test for individuals.
Okay, great. Thank you.
And might I say, if providers want to schedule their patients, I would recommend that you call the 211 nurse triage line with your patient so that you can get that patient scheduled.
Okay, great. Thank you, Dr. Wooten.
Just a point of clarification, the Escondido or North County testing site is open from 10 to 3, and the Chula Vista site at the Chula Vista Oxford facility is open from 1 to 7. And I think we have a question now that's going to be directed to Supervisor Fletcher.
I think so. I'm not sure. This is Kelly Kyle with Coast News. What can you tell us about the seriousness of the COVID-19 pandemic in North County compared to the cities farther south, and how might that affect North County cities' responses to reopening?
Okay, that'll be Dr. Wooten.
Okay.
So can you read the question again?
Yes, just a clarification about location. What can you tell us about the seriousness of the COVID-19 pandemic in North County compared to the cities further south, and how might that affect the North County cities' responses to reopening?
Well, we are one county, and while the number of cases vary throughout the county, the city of San Diego has the most number of cases. Then Chula Vista has the second highest number of cases due to the population and the density of the population in those areas. So, and we have hospitals that have hospitals in various parts of the county. And as part of our EMS system, when a given hospital is impacted, they can distribute their patients to other hospitals throughout the county. So again, we are one region, and COVID-19 is throughout the entire county. The numbers, again, greatest in the city of San Diego as well as the city of Chula Vista, based on population.
And many cities are looking to county guidelines when it comes to reopening certain areas. What criteria are you basing your reopening decisions on, and what structures do you recommend cities have in place before they proceed to reopen?
During my presentation today, I provided information on the metrics that we would use to a phased-in approach based on the federal guidelines, phase 1, 2, and 3. And in the phased-in approach for phase 1, it really is the things that we have already kind of dialed down, if you will, was done last week, and that was the governor's executive order as it relates to necessary surgeries, and the county followed suit with that on Friday. And I actually shared with the public what the various phased approaches would be for individuals, for businesses and or employers, and then specialty employers, including schools and hospitals and long-term care facilities. So I went through that in much detail today in my presentation.
Thank you. And Guillermo from Univision he's requesting if you could please reiterate the details about how people go about getting tested at any one of those two locations. What is the process they need to go through?
First of all, calling their provider, and then together you can call 211 and schedule an appointment through any of the 2 drive-through facilities that have been scheduled in North and South County.
Okay, great. And I have one for Marilee Moore from Fox 5. When can we expect to see FDA-approved antibody testing to come to the major healthcare providers in San Diego County?
Well, that process is taking place as we speak, and I think we've talked about that on numerous occasions. The FDA for serology testing, was that the question? Yes. For serology testing, the FDA is providing emergency use authorization, and that will be part of the strategy for our laboratory testing task force, is to form a sub-working group to figure out, number one, what is the test that various entities, the county, our hospitals will be utilizing here in San Diego, and then what will be the utilization. And that's going to be a while before we can have a very concrete plan for what that will look like. Thank you.
That concludes our questions for today. Before we close, I want to highlight some great efforts that occurred over this weekend. Last week I mentioned that San Diego's favorite son, Bill Bolton, organized a virtual bike ride to raise money for COVID-19 relief. Well, the Bike for Humanity this weekend raised over $100,000. Bill started a solo bike ride Saturday in front of the County Administration Center, and more than 1,500 people participated in their own bike rides or activities. I want to thank all of the participants, and especially Bill and his partner in the event, Tony Finn. It's just another great example of how everybody in San Diego comes together and works together. And we hope that's going to continue as we deal with this COVID-19 crisis. We'll see you tomorrow at 2:30. And remember, stay in place, maintain space, and cover your face. We'll see you tomorrow at 2:30. Thank you.